Hello and good evening to another webinar of Ryonex Biomedical Ltd. Directly from the studios in the Sauerland Pyramids. Yes, hello, good evening also from my side. This is the third webinar of our webinar series. A very warm welcome also from my side. I will be moderating again with Mr. Heimes, and we will have Mrs. Peuschel from the Paul Schmidt Clinic and Mr. Jörg Günter, a building biologist. They will enrich our webinar with their expertise. Exactly. And we can promise you that we will certainly be showing you very interesting studies in this area. I must say that they have also really surprised us. Yes, and that brings us to the topic of respiratory infections, electrosmog exposure, and asthma. Yes, we already mentioned our speakers, already introduced them to set the stage for them. However, as this is a medical topic, in particular asthma, we will get medical support from Mrs. Kerstin Peuschel. She will explain what asthma actually is from the medical point of view, how asthma manifests in practice in patients, and we have invited Jörg Günter as a graduate engineer and building biology measuring technician who was also trained with us at the Paul Schmidt Academy and actively works with us and gives support. He will be addressing the connection between asthma and electrosmog and will give us tips and tricks and information about it. Yes, and before we dive in, as always, the legal disclaimer. Please note that the many tips and advice in this webinar cannot replace the visit to the naturopath or the naturopathic doctor. Furthermore, please note that conventional medicine has not accepted nor acknowledged the effect of bioenergetic vibrations, despite all the available studies. It is just a long way to go. Today, we will be again speaking about a very interesting effect. So we will be presenting a study on the subject of asthma, which has been published in the medical journal. And that shows us that even conventional medicine is increasingly dealing with these issues. And that's a good thing. Yes, and with that, let's start with the topic of this third webinar. We will now present the study, which really surprised us all, didn't it? Yes, because it is very nice for us that everything that we have been contributing to you for many years, all our experience with energetics, with bioresonance according to Paul Schmidt, these are experiences, and you often hear from others, okay, but where's the proof? And that is why we are really very happy about it. We have our own study experience and we know how time-consuming and expensive studies are. There is an incredible financial effort for each study, so we are very pleased when we see that this study is in line with our experience and we can present something like this to you. Yes, and the question always is what the impact is, what the intensity is, so what kind of influence does it have, what kind of study was it? And that's why we took this very difficult path that is just necessary in science, which are the clinical, prospective, double-blind, randomized, placebo-controlled studies. This is necessary so that you can actually convince conventional medicine. I mean, the bottom line is that patients are only interested in whether they get better or not. That is, of course, the main issue. But in order to establish ourselves, and you also have seen the legal notice, we, of course, refer to it because it gives us an additional security. And the study we will be presenting today is a study that has been published in the medical journal. This means that we cannot say, oh, well, who knows where it came from. Sometimes people say that there are the most unbelievable discussions on that topic. And we now have reached the point where we can say, look at this study, a very large study that has been carried out over a very long period of time with the results that certainly not everyone had present. And that is the relationship between asthma or the risk of asthma in children when the mothers were exposed to electromagnetic fields during pregnancy. That is the subject of this study. Yeah, the study was conducted in Chicago, and what I find very impressive is that we are talking about 626 children who were followed up for 13 years. I think that is a very long period of time, and that is also very meaningful when you can draw results from such observations. For me, it's very interesting because I have 2 children myself, and this problem or this topic of the study relates to pregnant women, which is simply very special because, of course, one takes on responsibility during pregnancy. And I believe that it is known how sensitive pregnant women are, but especially when it comes to magnetic field exposure and electromagnetic exposure in general, I think it has been somewhat forgotten. That was my impression. Yeah, but also through advertising in this area, it was often shown like, for example, when I remember pictures of pregnant women with a laptop on their belly. That is like when you say, oh, take it easy, it doesn't have any influence at all. And that is just the contrary to everything we have been able to find out in the 40 years of rayonX and bioresonance, according to Paul Schmidt. And this study, and that is the essence for us, is that we have decades of experience. We see the influences, and in the end, a study comes out and says, look, this is exactly what was proven in a clinical study with an unbelievable effort. And it confirms once again that our experience is right. And as well that our assumptions are right. And that is very impressive. I'm sure some of you will want to read about the study, and we want to give you the main facts nevertheless. Children are 3 times more likely to develop asthma if their mothers were exposed to elevated or extreme electromagnetic fields during pregnancy. And I think that's really true. I found these figures very impressive. It's a good reason to take another look at it in combination with our biofield formers. Where can we give support? Where can we counteract in this case? Exactly. The point is, just imagine. This study analyzed 626 children, but that also means that 626 mothers were tested during pregnancy. And they were wearing a measuring device during pregnancy, which are 9 months, and the intensities of the electromagnetic fields were recorded in order to make a comparison, in order to compare it. I think it's absolutely wow to even pursue such an idea, but it simply shows that the knowledge of the influence of electromagnetic fields, and in particular of pulse modulation, is a topic that is now being taken seriously, and this is simply shown by the fact that such studies are being carried out, and that is great. And we have just said that what we see here, namely that we simply have to reduce influences of this kind, is precisely the cause-oriented therapy approach of bioresonance, according to Paul Schmidt. This is our guideline, which we have been following for 40 years and which has been proven again and again by such studies. And with our system, we want to bring this cause-oriented therapy approach to life. This means We have RAH programs with which one can energetically test the most diverse causal influences in order to then evaluate them and then also compare them with the patients and to find solutions. And in the end, of course, this also leads to the application of building biology and to the products. I find it impressive. Yes, it always comes back to the cause-oriented therapy approach. When you listen to everything, you think, yes, of course, it has to be like that. So it's nice when more and more people think that. Yes, exactly. And it's logical that one does not work symptom-oriented, but cause-oriented. And good systems always prevail at some point. And we are well on our way. I think that's great. And the study gives us a real boost. And that's why I'd like to come back to the philosophy. Of course, we are testing with BaPS, in particular with the RAH and the Rayoscan or our ECG-based biofeedback system. We test which RAH programs are especially needed or accepted in the body, and from that we also derive causal burdens. When I think about how many patients we have already supported with the mini Ryonex alone, hundreds of thousands. It's an unbelievable number because we have simply seen that if the energy in the body is not enough to fight an illness, then it will not work. That is very difficult. And in cases of disease, that is very important. And when we say energy, we are of course referring to ATP and so on. And that's precisely what we want to support with our mini Ryonex and the like. Yes, we spoke about it, and we like to address different areas. We want to convey them to you. This is actually the purpose of this training. Exactly. And we see that no matter which topic you take, the cause-oriented therapy approach is always at the center. And when we talk about deficiencies, we also mentioned this topic last time with our expert speaker, Mrs. Phillips, and it was great. The same goes for the area of microbiome with the Rhioflora, which is very important for keeping the digestive system in good shape. Here we often observe deficits, but also, of course, through nutrition that we support the body with very special supplements to get rid of certain substances that may have accumulated through certain life situations. And with relation to that, we have the topic of electrosmog, and this is exactly the study that we are now addressing, then geopathy, and then finally, to round it off, our bioresonance therapy. That is the philosophy of Ryonex. Yes, but I think before we dive into the topic of electrosmog, we will first speak with our medical support, Mrs. Peuschel from the Paul Schmidt Clinic, to define what is asthma. Because we had the topic of respiratory tract infections, and now we will learn something more. And I'm really looking forward to her input. Mrs. Peuschel, welcome to our webinar. Welcome. Yes, thank you very much for the introductory words. Hello from Heilbad-Heiligenstadt. For those who don't know me yet, I'm a trained conventional doctor in the field of surgery. We have been doing bioresonance according to Paul Schmidt since 2002. So we have a little bit of experience that we can draw on. We are located in Heilbad-Heiligenstadt in the center of Germany at the A38 highway. And as I said, we deal with the whole field of naturopathic treatments. Today, I would like to tell you something about bronchial asthma. In the previous webinar, we had already talked about infections of the lungs or the respiratory tract, and today we will be speaking about asthma. We'll focus on it because it is another special form of respiratory disease that doesn't necessarily have anything to do with an infection. I have found a very nice quote here to begin with. Breathing in, I soothe my body and mind. Breathing out, I smile. Dwelling in the present moment, I know it is the only moment. I sometimes have to think about this when I'm on the way with the emergency ambulance to asthma patients who are having a severe or very severe attack. In fact, sometimes people say, oh yeah, by the way, he or she also have asthma, but it can be a huge problem for those people affected, and it is hard when they have a severe attack and can no longer cope with it. And I think it's important to bring a bit of structure into it. This is the structure. This is what I will be doing today. Of course, first of all, we need to clarify the term, then speak about causes, symptoms, and therapy. Also, some patient experiences and examples on how we can handle it, which is important because, pollen allergies will soon be on the rise, and many people have also asthma symptoms with it. So, what does asthma actually mean? Asthma comes from the Greek and means gasp of the breath, and that's exactly what happens when patients have such an attack. What happens? The airways narrow, and it can happen suddenly as an attack. Asthma is a chronic disease, and these acute asthma attacks can stop or resolve spontaneously if they are mild. The patient usually knows how to act, has usually some strategies to cope with the attack, or they can take medication for it to stop. What types are there? There is the allergic asthma, which, as I said, will soon play a role in the pollen season. This is also called the extrinsic asthma, the non-allergic, or also the chronic or mixed forms. I've written down a few causes so that you can see that it's actually multifactorial. There is no such thing as asthma in general, so it's very patient specific. Okay, extrinsic asthma. This is often an early allergic reaction to allergens. To pollen, for example, IgE production, but late allergic reactions can also occur. This is the case of typical patients who do not have any problem throughout the year and who during the pollen season simply suffer from asthmatic symptoms from time to time. Intrinsic asthma often occurs after infections, in particular viral infections, because they sometimes cause lasting damage to the mucous membrane. Normally, they are not early allergic reactions. If I do a blood test, I hardly find IgEs, but I actually only have this late reactions to certain things. The cause is usually somewhat more severe, and the onset is also later in life compared to the pure allergic asthma. You often have these mixed forms of allergic asthma and a reaction to non-specific triggers. It can be cold air, it can be fog, smoke, perfume. I recently had a patient in the last emergency service who had been sitting in a salt cave. He thought it might be good for his airways, and he was exposed to the wrong concentration. They had two different salt caves. He went into the one with a high concentration, and that could have triggered his attack. Then occupational dusts, and for example in bakeries you have the flour dust asthma, and painters are exposed to paints, solvents. There are nickel allergies, or just simply due to irritation of the bronchial system due to smoke or vapors. It can come to asthma symptoms. There are also forms of asthma that can occur with medicines. These are the non-allergic forms, especially in the case of aspirin, quite often beta blockers, but also non-steroidal anti-inflammatory drugs such as ibuprofen or diclofenac. Then exercise-induced asthma sometimes occurs in athletes, especially in young patients who develop asthma symptoms due to the cooling of the bronchial system due to the stimulus. When jogging, for example, and then they develop these symptoms. Then reflux asthma is relatively rare. Of course, this requires that reflux from the stomach goes into the esophagus, the gastric acid goes up and then basically is swallowed again, a part is inhaled, and the contact of the mucous membrane with this aggressive stomach acid can also trigger asthma symptoms. Then brittle asthma, no specific trigger could be identified here. This type is generally a very severe cause that happens after inflammations, after infections. Then there are pre-stages of asthma. Patients simply have a dry cough in response to certain things. They often say, when I go out, when there is a change in weather, or when I come in from outside, then I have this dry cough. When there is a change of temperature, for example, and then you can use prophylactic measures beforehand or pay close attention to whether the patient will develop asthma or not. The transition to COPD, to chronic obstructive pulmonary disease, is seamless at some point. The patient then complains about constant coughing and phlegm, even without an asthma attack or infection. That's something you should be looking for. What happens with such an asthma? Well, I have a constant inflammation and immune response in the bronchial system. The bronchi and bronchioles are constantly on alert. They are hypersensitive due to constant inflammation. It is a vicious circle. It maintains itself due to the constant inflammations. The sensitiveness increases and then the alert increases. The presence of inflammatory cells in the bronchial system increases. And when a harmless stimulus, anything, comes into play, the bronchial system reacts with a severe immune reaction. A spasmodic narrowing takes place. The mucous membrane swells. There is an increased production of viscous mucus, which blocks the airways. This means that we have a typical obstruction, and the symptoms, the respiratory muscles try to fight against it, and they are overstrained. At some point, you can observe that the patient uses all respiratory support muscles to get oxygen supply. Exhalation is particularly difficult. The air remains in the lower parts of the lungs and cannot be exhaled, the so-called air trapping. And that affects previously healthy parts of the lungs simply due to an obstruction of volume. At some point, we have a combination of an obstructive and restrictive respiratory disorder. This in asthma leads to narrowing and obstruction. Symptoms. There is an inflammation of the mucosa and thick viscous phlegm forms. The patient has a very strong dry cough. Coughing fits. He actually has a very, very hard time expectorating. There is a wheezing sound in the whole lung. It is difficult to speak, and physical strain is no longer possible at all in most cases. The respiratory rate increases. The patient tries to breathe faster in order to get air. The circulatory system reacts accordingly with an increase in heart rate and sometimes also an increase in blood pressure, simply to ensure the oxygen supply to the body. The patient has more breathing effort and naturally becomes exhausted. He uses auxiliary breathing muscles. He will then support himself, lean forward in order to include the entire chest in the breathing. He often complains of pain in the chest cavity, especially when breathing in. Then shortness of breath, as I already said, it is caused by the obstruction, by the air trapping. The lungs become distended, the airways narrow, as we have already seen. This means that the mucous membranes rub against each other to some extent. The breathing sounds increase as a result, and we can hear the typical wheezing and whistling sounds of an asthma attack. You can hear it even without a stethoscope. Such an asthma attack often lasts only a few minutes, but it can also develop into a so-called status asthmaticus. In this case, there is a prolonged asthma attack which, despite medication, lasts for many hours, sometimes even for more than 24 hours, or becomes a persistent asthma. The asthma symptoms can be divided into different stages. We have stage 1, which is a very mild, intermittent asthma, as we know it from those who have a pollen allergy. Such an attack happens no more than once a week when it gets really bad. There are many symptom-free intervals. Many are symptoms-free throughout the year and only have symptoms in certain exposure situations. Stage 2, asthma attacks occur more frequently. We have the mixed or intrinsic forms of asthma. Attacks occur more than once a week, but the patient recovers. The patient is completely symptom-free in the intervals between the attacks and can do everything there, have no restrictions in their daily life. Stage 3, there we have a moderately persistent asthma. The patient has daily discomfort, problems with breathing, asthma symptoms, especially discomfort at night, and they usually say that they have it a few times a week, can no longer do certain activities in their daily life, sleep is disturbed, so it has a clear impact on the patient's daily routine and life. Stage 4 is severe asthma. The patient also has persistent symptoms day and night. Here the transition to COPD is relatively seamless. The patient is impaired, significantly impaired in his life and sleep, and has also sleep apnea symptoms. What can be done to find out whether the patient has asthma or not? Of course, the anamnesis is crucial. I have to ask what occurs when, how does it occur, how long does it last, what symptoms does the patient have. The peak flow measurement is a very good measure. You can't necessarily give a standard value. There are standardized values, but it is important to look at the patient's course and progression. So what is the peak flow the patient achieves? So what is the maximum rate of exhalation? And if I measure that and write it down every time, then I have a very good progression reference for the patient. Of course, the normal lung function test, the spirometry, where you can see changes. Then allergy tests, very important. The first thing to consider here is bioresonance, where you can very beautifully carry out an energy test on the patient. Then challenge tests with histamines are also a possibility. Also stress tests, especially with stress-induced asthma. Then bronchospasmolysis test can also be done. This means that the patient is given an appropriate asthma medication, and spirometry is carried out after and before to see what effect it has on my test results. Then, if necessary, I can carry out X-ray, CT, bronchoscopy with BAL and also lab tests and blood gas analysis. Our asthma patient, the scan mainly shows the finding listed below. The immune system, we see that an allergy is usually present. Histamine is often present. Sometimes individual pathogens come up, especially when there are additional infections. The intestine is often involved and affected in some way. Then bronchia, lungs, of course, asthma, stress appears, also adrenal gland insufficiencies, and also cortisol blocks often come up in these asthma patients, especially in patients who have severe forms of asthma or a prolonged course of the disease. So what do you do with such a patient? In an asthma attack, you have to administer some kind of medication to stop the attack and generally improve the patient's respiratory and general situation. Inhalation with better 2 mimetics if I have them, or intravenous medication is very useful so that there is a first relief and I can continue to work with the patient. In the next few days, allergy avoidance is often not possible, but I can achieve a very good desensitization of allergies with bioresonance. I can check this, test it again and again, and can actually see how these allergens, the allergy alert in patient decreases. It is always very nice for the patient to see how it develops, and also very motivating for the patient. I have written cortisone in brackets. Sometimes it is necessary to give it, but in principle and in the therapy of asthma attacks in particular, it is actually not recommended because the effect simply takes too long and it does not necessarily have much effect in acute cases. In point 4, I have listed medications that can be given as a support, sometimes as permanent medication, or if I know that the patient is currently exposed, especially during the pollen season. For example, chromoglycic acid can be given as a nasal spray, eye drops, or tablets, or to inhale, of course. You can do different things to support the patient through this time. Also, therapy with your own blood, for example, the patient's own blood globules, for example, a very nice thing. Homeopathic remedies can be given, various phytotherapeutics to improve local symptoms, to improve mucous membrane. Of course, there are also immunomodulation therapies, and I have noted them here, and it accompanies the bioresonance therapy very good, but also with the compact programs, also for home therapy that can be done very well with the PS10. Inhalations are very important for asthma patients or for lung patients in general, not necessarily always with medication only. You can also simply inhale physiological saline solution to simply moisten the mucous membrane to generally improve it. Then respiratory training, breathing gymnastics, very important for the patient to show him or her what he can do or she can do in an acute asthma attack with the pursed lip breathing technique to simply improve the situation of the lung, to relieve the constriction and the spasm of the bronchi. Normal weight is important. Sports, also abstinence, of course, and learning appropriate relaxation methods so that the readiness to develop such bronchial spasm decreases. Of course, infection treatment is also important with asthma patients. It is important that I take a look at it and notice early enough when I have to intervene. Then I already mentioned bioresonance and intestinal cleansing. That is very important because these allergic forms of asthma have a lot to do with the stability of the microbiome and of the intestine, and there is actually a mutual influence of the bronchial and intestinal mucosa. I have a patient example. She is 11 years old, a female patient. She has had allergic asthma for 5 years, and her mother reported that it is now increasing even outside the pollen season. It used to be only in pollen season, but now she has noticed that these asthma attacks also occur off pollen season. The peak flow measurement was unremarkable. In the allergy tests with the bioresonance, we took a set of 70 and we found allergens such as pollen, dust, and mites. Of course, very important. Always pay attention to animal hairs, fibers, dyes, and laundry detergents. This was always desensitized whenever the patient came. In the scan, we had the following: immune system, allergy, bronchi, and of course, stress, histamine, and also an impairment of the adrenal gland. In this case, you can act very well with the appropriate bioresonance therapy, allergen desensitization, and also various homeopathic preparations and also own blood globules to successfully counteract the symptoms. Well, you can see on the slide, phytotherapeutic support is also possible, especially if the patients have a very stressful, dry cough when they lie down in bed at night. They can't get any rest because they have this cough. Here I would like to point out that you actually ask the patients whether mites could be an issue, maybe replacing mattresses, all these things. That does not mean that one suspects that the patient is unclear. Mites simply multiply, and after a while you have to replace these things or use appropriate mite-proof covers for relief. Probiotics are of course very important, especially with allergic asthma. You should make sure that you always treat the microbiome as well. The second patient is a middle-aged woman, was already complaining of asthma with almost daily symptoms and also night shortness of breath episodes, which had a very negative effect on her sleep and also limited her performance the next day. The patient had a clear exertional dyspnea, especially when climbing stairs or even when walking a bit faster. When asked, it turned out that this had developed since she works in food care. The patient is a podiatrist, chiropodist, and in the many years she had worked there, she got a dust and fungi contamination. Now she also had patients from a nursing home who had much more nail fungal disease. Over the years, the dust and fungal exposition had affected her significantly. During the energy testing by bioresonance, we actually only found a slight pollen allergy in the 70s test, a bit of fungi, but it wasn't very strong. So we had spontaneous IgE-mediated allergic asthma, but then we excluded it. So it was more of a mixed form of asthma. So then in the scan, we clearly found an impairment of the immune system, of the bronchi, but also atypical pneumonia. One has to check whether the fungi have caused the damage or not. Then, of course, intestinal flora, especially here in the large intestine. The patient also had signs of colitis, a sign of sinusitis. The muscles of the upper limbs and trunk were affected. Also sleep disorders, of course, headaches, which reduces the general condition and vitality of the patient. What did we do with the patient? Of course, bioresonance therapy. We desensitized the few allergens that were there. While sitting in the chair, she was, of course, given appropriate infusions, first expectorants and theophylline, but also various other homeopathic remedies. intestinal rehabilitation was carried out on the patient at the beginning of the treatment, where her lung condition was very bad. She was given oxygen therapy, partly with a CPAP module. We showed her what she could do in terms of breathing exercises and discussed with her what she could change in her profession, what occupational safety measures she could take to simply reduce the exposure. I brought another patient example. He is 19. He has had atopic dermatitis all over his body since he was 5 years old. Before that, he always had recurrent infections. The mother said that as a little boy, he was always sick. He had pseudocroup when he was 1 year old, asthmatic bronchitis, got a lot of antibiotics because of this. The allergy tests in the 70s said had impressive results. He had basically everything, all possible allergies down to dental materials. So there was a very strong reaction of the immune system in terms of allergy. You could see that the inflammatory process in the body was strongly activated. The immune system was strongly activated. There was this strong shift to inflammation and overreactivity, and that's what we could see in the scan. Impairment of vitalization, immune system, allergy, of course, but also impairment of other mucous membranes, so sinusitis, bronchitis, atypical pneumonia, but also in the area of the entire gastrointestinal tract, of course, also triggered by the many antibiotics he had received as small child, and skin, atopic dermatitis, also adrenal gland, histamine stress. The patient had a lot of stress with his illness and psyche, because as a young patient at that age, you don't want to have to struggle with this disease. You want to have other things in life. And another problem is of course detoxification, as the whole system and immune system was completely overloaded by the many years of illness. What did I do? Of course, allergen desensitization, of course. It also took a relatively long time because, as I said, there were so many things to which the patient reacted. And we also tested his own objects, which he brought with him, and included them in the harmonization to have a starting point to begin with. It was about finding out what he could take, making sure that it doesn't worsen his situation. So bioresonance played an important role. The patient also received spagyric medicines and autologous blood therapy. For the acute phases, he received chromoglycic acid, and we had to do an intestinal cleansing for the patient in order to have a starting point to create good conditions for the healing process. In the meantime, the skin had improved very well, but as usually with asthma and atopic dermatitis, one thing gets better, but the other things flare up. That was also the case here. He developed asthma symptoms again when he started therapy. This is a sign of initial worsening. So, of course, we had to advise the patients and tell them and their relatives in advance. He was then prescribed additional inhalations, then also appropriate infusions against symptoms. Then the asthma symptoms subsided again. Then the skin symptoms came back with flare-ups of atopic dermatitis, which of course did not make the patient happy at first, but of course you have to accompany him through this entire process. Currently the symptoms of the skin are subsiding and he has not developed asthma symptoms again. The treatment is still ongoing. Here I wanted to point out how important it is to guide the patient through such a therapy and to also discuss certain reactions of the patient. So disease disease-related reactions to discuss it with him in advance and then to give support when they occur so that the patient feels in good hands, knows what is happening to him, and is also well accompanied through the entire process. Finally, a beautiful quote from our Zen master: breathing in, I calm my body. Breathing out, I smile. Dwelling in the present moment, I know this is a wonderful moment. You can think of it as a motto that describes the moment when the patient has overcome his acute asthma attack and the symptoms and just then sits in front of you happy and relaxed and can actually breathe again. Yeah, thank you very much for your attention. Wish you all the best for this webinar, and greetings from Heiligenstadt. Mrs. Peuschel, thank you very much for your practical presentation on asthma. And yeah, I must say that it is always very exciting to listen to you. If questions have come up, you can address them either to the Paul Schmidt Clinic, to the info at paul-schmidt.clinic.de. This would be the direct access to Mrs. Peuschel, or you can send your questions to therapiezentrum@rionex.de. And these questions will be then included in the pool of questions which we will address in our fourth webinar. Yes, but now we will refer to the study again, and we will come to our next expert speaker. Yes, we are very happy to have our building biology measuring technician, Mr. Jörg Günter, with us, who has been with us for many years, also as an architect. He knows a lot about the situations inside buildings, for example, with electrosmog, but certainly also with mold. And he's a real expert in his field, and he will show us the possibilities of bioresonance, according to Paul Schmidt, specifically of biofield-forming devices and how we can support asthma patients energetically. Mr. Günter, welcome to our webinar. Yes, hello, Mr. Günter. Hello, Mr. Bunkenburg. Hello, Mr. Heimes. Thank you for introducing me. This evening I'm going to talk about building biology, but first I would like to introduce myself. My name is Jörg Günter. I'm 60 years old. I have a degree in engineering and architecture and have been working in the field of building biology for over 12 years now. I have had various trainings, etc. And today I'm here to talk about building biology. I greet all participants and also my dear colleague Wolfgang Siebers. Hello, Wolfgang. Hi. Okay, let's begin. What is building biology? It is about finding the balance between nature, the built environment, and people, making healthy living and living possible. What does that mean? It means that humans are at the center and that we, the building industry, has to build everything right. We will come back to that in detail in a moment. It should be quite natural. So the building materials should be natural. And that also should be balanced and reasonable. In the building industry, some things have been done in an unreasonable way, or in a few cases need to be done like this as well. But it is important that we get the right balance. Then there is the question of what the building biologist does. And to answer that, we simply have to distinguish two areas of activities. One is the advisory activity, and the other is the investigative activity. In the advisory work, there are several things. For example, carrying out site investigations, building land can be examined for electric fields or geopathic burdens, for example. If you took that into account, especially geopathy, that refers to water veins, as I will explain later, then you would have to position the house in such a way that it is as free as possible from these stresses on the property. You could also measure electrosmog in order to consider protective measures, shielding, and so on in the design phase. Furthermore, it's about the building construction itself. It is about building physics, as you can see on the bottom right of the slide. For example, the humidity curve or movement in the wall is such that the dew point is located on the outside and that no moisture forms on the inside of the wall, because if there is moisture there, mold is happy and then I will have a lot of work. Furthermore, it's about building materials. Yes, they should be as natural as possible, but building materials alone are not enough. It's also about primer, adhesives, many things. If I have a floor, it's important that it doesn't slip. We need to use adhesives, but it's important that you use certified materials or wall paints. As you can see on the slide, there are all kinds of natural colors as well. So it is a very wide range of things that one could actually take into account. Furthermore, the building biologist can be involved in the planning of the electrical installation. So how many electric circuits are needed to have bedrooms that can be turned into electricity-free bedrooms, for example, using electricity disconnectors to take electricity out and to be able to sleep without electricity. I will go into this in detail later. Let's move to the second activity. This is the investigative activity. It is about finding what are the negative influences in existing buildings. There we have a wide range of things that can have a negative effect. Let's take the most important ones, that is electrosmog, then mold, geopathic interference zones, pollutants, and to a lesser extent radioactivity, light and sound, also according to studies and investigations. So the main areas that are investigated are electrosmog, mold, geopathy, and pollutants. Here we see the geopathic interference zones. Here, the most important thing is the cause-oriented action. As Paul Schmidt said, we act in a cause-oriented way, and that is the right thing to do. The most important thing is to test the position of the bed. This is because we lie in bed for at least 6 hours, we sleep, and during the night the body has to regenerate, and if it is disturbed by negative influences such as water veins, fault lines, the global network grid, Hartmann lines, Curry lines, Banker lines, and also crossing points, then these simply affect us with their negatively polarized vibrations. These vibrations, as I have just said, affect us, and the question is, what can we do about it? Of course, you can try to move your bed to another place that is free of these stresses, but to be honest, this is very hard. I can tell you from experience and from the many bed position examinations, you will hardly find a place like that. It's almost impossible, and that's why it doesn't make sense to try to position a bed so that it's completely free of stress. There is always something that is affected, either the foot or the head or whatever. But we don't need to demolish the house. We don't need to move the bed. That's no problem. We just set up a duplex 4 or a duplex 4 Pro with the appropriate rayonators. We'll get to that in a minute. So what happens then? You have to imagine that, for example, if we now take the fold lines or the shiftings with a basic frequency value of 34, it vibrates with a negative polarization onto the body. And the duplex does nothing other than take up the same vibrations, and then it emits it minus and plus polarized. That means we generate a bipolar field. And if you know that, for example, I stick to the 34 fault lines or shiftings, and we know that if we know that our sleep center also vibrates with 34, you shouldn't be surprised that many people who sleep in these shiftings have sleep disorders. So when I do such examinations, I test the people who will live there, and when doing the test, I see that the 34 is blocked, then I already know that those people are sleeping on a shifting or fault line. And believe me, 99.9% of the cases are like that. And I also know that when the duplex is placed there, it is regulated, with some people earlier, with some later. But they start to sleep through again for 4, 5, 6 hours and even longer. Let's come to the second large topic, which is mold. There are 100,000 known types and all kinds of species, and they are older than mankind. As a rule, they do not harm us. We live with mold, and our organism can actually cope with this completely normal burden or stress. But if we have mold in the building, the first thing we must do is act on the cause. That means we have to find out what caused the mold. Often, structural inadequacies lead to moisture penetrating into the building from the outside and soaking the building materials, the wall structure, and the plaster. And if the mold gets moisture in addition to the mineral substances it needs to grow, then it is happy and it multiplies like mad, and then we have the black stains that we actually don't want to have. And if it multiplies like that, then it also produces more spores and produces metabolic products, the so-called mycotoxins. Yes, and when it becomes too much, it becomes very stressful for our body. So, when mold is visible, we know that it is there, but often we don't see it. And that's very important to know. In 80 to 90% of the cases, mold contamination is invisible. It can be under the paint or behind the wall, so that you don't really notice it at first. You can measure it with the appropriate examination methods, such as the one shown in the picture, where a 2-chamber air pump is used to measure airborne germs or particles, and then you know how polluted the air is. And if you know that the air is polluted, that there is a pollution, you can reduce this biological effect. Of course, the mold has to be removed first. Then the whole area has to be cleaned. It is very important that all the spores that have settled everywhere are no longer present. But parallel to this, one can very well support the body after the exposure to the different species of mold. For that support, I would recommend to have a stationary or on-site bioresonance device, so to place the duplex of 4, so that the body is really supported. Of course, you can also treat in the framework of a therapy, but a stationary duplex is the perfect solution for this. Let's come to the third big topic, the electrosmog. We have to distinguish between electrosmog in the high frequency range and in the low frequency range. The limit is at 30,000 kilohertz. Above this limit, it is high frequency, and below, low frequency. The low frequency electrosmog is like for example, the electricity from the socket or from the power line of the railway or the tram and things like that. And everything above that, above 30,000 kilohertz, are high frequency radiations such as Wi-Fi, Bluetooth, or wireless phones. Everything that we actually have in the house itself. And that's a good point, because we produce 80 or 90% of the electrosmog ourselves. If, for example, I go on holiday to Majorca, for example, and I want to know the temperature in the fridge, or I want to control the heating, everything is possible nowadays. Everything can be controlled, and it is mostly controlled via Wi-Fi, so that I have a permanent burden and stress in the house that affects my body 24 hours a day. Here you can see how you hold a smartphone to your ear, hold it to the right in this case, and then you can see via the coloring what happens in the brain, in the head, what effect radiation exposure is having. And when you know that since 1995 or 93 until today, the brain tumor rate has massively increased, I think more than doubled, then you ask yourself, does that have something to do with it? I tell you, yes, it has. I think 90% of us Germans are also right-handers, and we hold the device to our ear, and that's not good for us. But that doesn't just apply to smartphones, also applies to radio exposure, 4G and 5G. 5G is particular hot topic again. So it affects us. So let's move to the cause-oriented action. What can we do? As I just explained, such radiation can be technically shielded. You can use different materials, you can apply colors or paints, you can put shielding tiles on the wall so that the radiation coming from outside no longer penetrates into the building. Yes, for that we need experts that know how you do it. But you can do many things yourself. For example, if you don't need Wi-Fi, then just turn it off and only use it when I really need it, and don't just let it run in the background. That's how I reduce the burden. And generally, with a smartphone, I have mine here. I always try to speak over the loudspeakers, and that way I reduce the effect of the electrosmog on my brain. It reduces it by 90%. Of course, I can only do it when I am not in public, but that's just one simple way to reduce electrosmog. What I didn't mention is that, of course, you can measure such exposures. In order to have cause-oriented action, you need to know which burdens we are dealing with. And then, as I mentioned, one should simply turn off certain things, shield them, so you can reduce that. But there are influences you can't avoid, and you are biologically affected. You can't avoid it. It's not only at home. When I'm in a car, nowadays I have Bluetooth exposure. I go to the office, there will be probably Wi-Fi. I have all kinds of radiation that can create blocks in me. They are listed here. For example, you can see electrosmog, basic frequency values that we are exposed to in many areas. Then the low frequency areas and the high frequency areas are listed separately. For example, mobile phones, DECTs, so cordless phones, Wi-Fi, Tetra, so police radio, Bluetooth, of course, and LTE, and 5G, which is also a current topic. What can I do? The stationary solution is quite simple. Here again, I place the duplex, and if I want to have it even better, I connect the corresponding rayonators to create a bipolar field where my body can regenerate, but is also supported in order to dissolve these blocks. That is very important. So maybe, okay, I can have this exposure in the office because there's nothing I can do against it. But when I'm at home, I have such a place of calmness, peace, as I said, as I normally say. I have 2 devices in my house myself, and it's quite interesting that people come to me, and when they stay there with me for a certain time, and then they say, Mr. Günter, your house is so quiet, so calm. That is quite interesting. It has nothing to do with noise or the noise volume. The body perceives this as pleasant, as balancing, as soothing, and this is then expressed this way. And then I start smiling and say, yes, I know why it works, of course. And then, of course, I explain it. So it's very important, this stationary solution that creates this bipolar field again, where the body is supported and where it can regenerate. There are also mobile solutions that I can wear on my body or that I can simply take with me. For example, there is the Mini Rionex 5G, so the basic frequency value 12.5 is generated there, and the most important 5G frequencies. 12.5 is, for example, the cell energy. So I'm wearing it here. I have it. This is mine. It's 12 years old by now, but it is still working, and it gives me energy. It gives me so much energy that it really makes me feel good, and you can also visualize that. I usually do that with my clients as well, or with people who are interested. It's quite interesting. And the new one, the 5G, as I said, has additional frequencies to support the body. We have to distinguish again. Shielding is one thing, and the support with the duplex or with the other devices is supporting the body. Yes, in the collection we have Mini Rionex, which I have myself, the 12.5, the ELO Rionex, the HF Rionex, the Car Rionex. These are all special small devices that also react to the individual burden values and support the body. And again, regarding the stationary solution and in relation to the rayonators, you can see that here there is an eSmog rayonator. That is the rayonator for low frequency electrosmog. The HF rayonator 3, there you can see the corresponding basic frequency values that support the body for this area. And the 5G rayonator, including the 12.5 and the 21.5, which can then be docked on to make the duplex work even more effectively. Very interesting is the 22.5. I just want to tell it very briefly again. This is our cell renewal. And this is a basic frequency value that is not only found in electrosmog, but also in geopathy, for example. And when you see that 22.5, so the cell renewal is possibly blocked by the corresponding negative influences, then you start to think about whether some things could go wrong with cell renewal. In the meantime, well, scientific research has proven that it can lead to cell changes and possibly to serious illnesses. So I think it is very important, and I am glad that I have 2 duplex devices in my house. So now, of course, I have tried to give you an understanding of building biology in a very condensed form. Of course, there is much more that could be addressed here, but this today is only a short version of the possibilities of how to protect oneself or how to support, to strengthen oneself. And the Ryonex products, the biofield-forming devices are ideal for this. Yes, I thank you for your attention. I'm looking forward to next time, and I wish you a very nice evening. And if you have any questions, just call. See you. Bye. Yes, Mr. Günter, thank you very much for the presentation from the perspective of building biology and this entire subject area, which is also an essential part of the cause-oriented therapy approach of bioresonance, according to Paul Schmidt. And we saw the slide that referred to the philosophy of Ryonex, and we spoke there about energetic support, and then we spoke about the energetic support through bioresonance therapy, according to Paul Schmidt. And now we want to see what possibilities we have. Yes, I would like to refer to the possibilities of energetic support we have when it comes to asthma. I think most of you are probably already so familiar with our Ryonex analysis and harmonization system that this might not be necessary, but I want to show it again. So an individual test with the RAH scan, but also with the BaPS scan, depending on how much into detail you want to go. This is very helpful for anyone concerned. Then we have the pathology program with the 4320 asthma bronchiale. We also have a test protocol and a compact program. And I also would like to refer to number 7049 regarding allergy upper respiratory, where you can energetically support bronchial asthma with our system. Exactly. And with that, our webinar again has been a very comprehensive one. We were able to present our cause-oriented therapy approach, which has made us progress internationally. This time we referred in particular to asthma. And you can see how nicely our therapy approach can be adapted. So thank you very much for your participation in the third webinar of this webinar series. We wish you a good evening. Yes, and we are looking forward to our final webinar where we will be addressing your questions. Thank you very much again for watching. Bye. Bye-bye.